A very good morning, everyone. Greetings. I am Dr. Pooja Jha Maity, working as Assistant Professor in Department of Botany, Hansraj College, University of Delhi. Today, I am going to discuss about the roots. We will discuss both roots of monocotyledonous as well as dicotyledonous, and we will start with the morphology. Morphologically, the monocot roots are fibrous root and they are adventitious in nature. That means they originate from the stem. So they are, that's why they stay close to the surface of the soil. They are not going very deep inside the soil. And you can observe this kind of roots in various palm trees, in most of the cereals and grasses. They form a very wide network of thin roots. So this kind of root is known as fibrous root. In dicot, the main root is long-lived, and this kind of root system is known as taproot system. It forms a single thick root, and from that thick root, small lateral branches are coming out. And this kind of root goes deep into the soil. And I am sure you must have been studied the carrot as a typical taproot system. Anatomically, both monocot root and dicot root are similar in some way and dissimilar as well. From epidermis to endodermis, both monocot root and dicot root are similar, but the telos region, they are quite different. So we will discuss the both, but before started discussing these two, I would like to explain few terms, because they are it is really required to understand these terms. The first one is the arrangement of vascular bundle, and it could be endarch or exarch. So this arrangement is based on the position of protoxylem and metaxylem. So what is protoxylem? Protoxylem is the primitive type or first formed xylem, and their lumen is very small. Okay, and metaxylem, they formed later in the development, so their lumen is quite big, and we are looking them in the transverse section. If the protoxylem is placed towards the center and metaxylem is placed towards the periphery, then this type of arrangement is known as Endarch arrangement. And here the development of primary vascular bundle is centrifugal. That means development starts from center and it goes towards the periphery. So that's why metaxylem is present in the periphery. This kind of vascular arrangement is seen in stem, while the exarch arrangement is found in root. And here the protoxylem is placed towards the periphery, and metaxylem, the bigger lumen, the later formed xylem, is found near the center. So this kind of arrangement is showing development of primary vascular bundle in a centripetal manner. That means the newly formed cells are formed near the center. Okay, and this kind of arrangement is found in roots. Now we are going to discuss different types of vascular bundle. There are two major types of vascular bundle. One is collateral and one is radial. Collateral, co means together and lateral means in the same lateral position. Another word which we are going to use is conjoint. Con means together, and joint when xylem and phloem, they are joined together. So this kind of vascular bundle is conjoint. That means xylem and phloem are joined. Collateral, that means they are lying in the same lateral position. It could be closed or open. If the meristematic tissue, vascular cambium, is absent, then we can say that this kind of vascular bundle is conjoint, collateral and closed vascular bundle. And if vascular cambium is present, then we can say it is conjoint, collateral and open vascular bundle. So sometimes in some cases like cucurbita, we can find bicollateral vascular bundle. That means phloem are present in two patches, outer as well as inner side, and xylem is sandwiched between them. And in this kind of vascular bundle, two layers of vascular cambium are present. Another kind of vascular bundle is known as concentric type, because in this one element, either xylem or phloem, is present in the center and other is present in the periphery. So if xylem is present in the center and phloem is present around it as a periphery, then it is known as heterocentric or amphicrebal. Both are synonyms. Heterocentric, hetero is something related to water and xylem is the conducting tissue. It is conducting water. So this kind is known as heterocentric or amphicrebal. Crebal is used for phloem. So it is around, that's why amphicrebal. On the contrary, phloem may be present in the center and xylem is present in the periphery. So here we can say it is a leptocentric. Lepto means phloem, so it is present in the center. So leptocentric or amphivasal. This is amphicrebal, this is amphivasal, or heterocentric or leptocentric. So all these kind of vascular bundles are found in stem, but this radial type is very interesting and it is found in root system. Here the xylem and phloem, they are not present in the same lateral position. They are found in different radii. If we are going to draw a radius from the center towards the periphery, then xylem and phloem will lie on different radii or different lateral position. So phloem is present as a patches and xylem is present as arches. So radial type in root and collateral type or concentric type in stem. Okay, before moving towards the anatomical detail, we should know that in roots the xylem are present as arches in different number. If 2 arches of xylem is present, then it is called as diarch. If 3 arches of xylem is present, then we can say triarch vascular bundle. Similarly, if 4, then tetrarch. If 5 arches are present, 5 arms of xylem are present, then pentarch. For 6, hexarch. And if the xylem arms are more in number, then we can say it as a polyarch condition. This is another colored diagram which is showing diarch, triarch, tetrarch, hexarch and polyarch system. Okay. So now we can study the anatomical details in transverse section of dicot root. This kind of details we can study either in line diagram or in a part cellular. So part cellular is in much detail and we can look what is present. The outermost layer is known as epidermis, and epidermis, epi means outer and derma means skin, that means outer skin. Fine. In root it is also called as epiblemma. Epi means outer and blemma means covering. So the outermost layer of root is also known as epiblemma, and sometimes it is also called as piliferous layer. That means those part of root epidermis which is having root hairs. Root hairs are unicellular in nature and they are the extension of the epidermal cell, and they are formed to increase the surface area of the epidermal cells or the roots so that they can absorb more water and minerals from the soil. The layer beneath the epidermis or piliferous layer or epiblemma, it depends on species to species if hypodermis is present or not. If hypodermis is present, then it must be collenchymatous, and if not, then this whole layer is known as cortex. Cortex is made up of parenchymatous cells. They are thin-walled and having lot of intercellular spaces. The cells of the cortex are filled with stored food material, that is starch, and then the limiting layer of cortex is known as endodermis, the layer which is light pink in color. Endo means inner and derma means skin. So epidermis and endodermis, that means outer skin and inner skin. Yeah, in root the epidermis lack the cuticle as well as stomata. They don't need it, they are not stem. Okay, so endodermis is a very important layer and it shows Casparian stripes. Casparian stripes are nothing but the deposition of suberin and lignin. They are deposited in the anticlinal walls of epidermis, and this deposition make the epidermis water impermeable. Okay, so why this is required? Because water enters from the root hairs. They enter into the root system, travel throughout the cortical cell and then reaches this stellar region. Okay, and the water moves via three pathway: symplastic, apoplastic and transmembrane, that you are going to study in plant physiology. Once the water reaches in the stellar region, especially in the xylem, then it is required to prevent the backflow of water into the cortex again. So that's why Casparian stripe is present in the endodermal layer. There are some passage cell. These passage cell are thin walled and they lack Casparian stripe or the deposition of suberin. So these passage cell, they are present opposite to the presence of protoxylem, and here you can observe that it is a tetrarch condition. That means xylem is present in 4 arches. Okay, and number of phloem, which is light green in color, they are also 4. Generally, number of phloem patches are equivalent to the number of xylem. So with the help of this passage cell, waters enter into the xylem. Below this endodermis layer, there is a pericycle, which is seen in the light pink. Now this pericycle layer is very, very important for dicot root, because the lateral roots, they originate from the pericycle. Not only this, the pericycle also give rise to the phylogen, that is cork cambium. That means it also helps in secondary growth and formation of cork in the older roots. As well as this pericycle also give rise to the vascular cambium, some part of vascular cambium, because this is a young root, so you can't see any cambial layer. The cambium is secondary in origin in roots, while in dicot shoot they are primary in origin. So yes, protoxylem towards the periphery in all 4 arches and metaxylem present in the center. Here the phloem are present in 4 different patches, and the tissues which is present between the xylem and phloem, they are known as conjunctive tissue. And the conjunctive tissue in dicot, they are made up of normal parenchymatous tissue. They are compactly arranged without any intercellular spaces. Okay, so intercellular spaces are present only in the cortical region. These things can be easily explained by the line diagram. The outermost layer is the epiblema or piliferous layer, followed by cortex, then endodermis, pericycle, 4 xylem arches, 4 phloem patches, and yes, pith is not present, and if present then they are underdeveloped. So in dicot root, pith is not present. Fine. So we can see and observe them in another diagram. This is a 3-dimensional view of a dicot root. Starting with the epidermis, it is having lot of root hairs, followed by cortex, then endodermis. Endodermis is shown in deep red color. Then xylem in 4 arches and phloem in 4 patches in yellow color. But one extra thing which is visible here is the vascular cambium. Now I already told you that vascular cambium is secondary in origin. That means in younger shoot they are not visible and they are formed by the conjunctive tissue. So these conjunctive tissue, they converted into meristematic tissue and form a crescent shape vascular cambium. Crescent means it is curved. Fine, but these vascular cambium, they are developed below the phloem and above the xylem tissues, and they are not complete. They are kind of incomplete. and then pericycle comes into the picture. The layer of pericycle present opposite to the protoxylem, they also become meristematic, and the whole cambium layer joined together. So that cambium looks wavy, and after the secondary growth, in secondary growth, the cambium produces secondary xylem towards the center and secondary phloem on the periphery outer side. After some time, this wavy ring of cambium becomes circular. So that is in the secondary growth of dicot root. But here in this, it only looks as a crescent shape vascular cambium. And here you can observe the tetrarch condition, the vascular stellar region of the dicot root. So protoxylem, that means the vessels with smaller lumen, they are present towards the periphery, and metaxylem towards the center. One more thing, the xylem appears little angular or polygonal in shape. This is also a characteristic of dicot root. And there is no pith present. These are the phloem patches, as well as you can see the conjunctive tissue. Now a quick recap, as I told you, epiblema, they lack cuticle as well as stomata. The cortex is having lot of intercellular spaces. They are very thin walled. The cells are round in nature, not barrel shaped. While in epiblema and endodermis, these cells are also parenchymatous, but they are compactly arranged and they are barrel shaped. While the cortical tissues, they are very thin walled, having lot of intercellular spaces and lot of stored food in it, that is starch grain. In older roots, exodermis is also formed. Exo means outside and derma means skin, and it is also a protective layer. And yes, I already explained that Casparian stripe as well as passage cell, they are present in the endodermis. Pericycle is single layered and it is present below the endodermis, and it is also made up of thin wall compact cells, and it gives rises to three things in dicot. One is lateral roots, other is vascular, part of vascular cambium, and cork cambium, that is phallogen. In dicot, vascular bundles are 2 to 6 and radial in nature. That means their arrangement is radial and it ranges from diarch to hexarch. Sometimes 8 arms of xylems are also present. Number of phloem is equal to the number of xylem. And one thing which you must know, that in protoxylem, whose lumen is very small, they show annular and spiral thickening in them, while the metaxylem, which is having bigger lumen, they show reticulate and pitted vessels. Okay, so pith is generally parenchymatous if it is present, or most of the time they are absent. Now we are looking at the anatomy of monocot root. So starting from epidermis to endodermis, they are quite same with the dicot root, but their stellar region is quite different. They are showing polyarch condition. So here you can observe that protoxylem, the smaller with smaller lumen, they are present towards the periphery, while the metaxylem, which is having wider lumen, bigger lumen, they are present in the center. So again, we can discuss the transverse section of monocot root with line diagram as well as part cellular. This is, here you can make cellular diagram in a small section, but this explains more. So the outermost layer is again epidermis or epiblema or piliferous layer, having lot of root hairs. Again, the root hairs originates from the epidermal cell, and they are increasing the surface area for absorption of water and minerals. Again, water will enter through this epidermal root hairs as well as epidermis, and then depending on species, hypodermis may be present or not. If hypodermis is present, then it must be of collenchymatous in nature, otherwise complete cortical layers will be there. Cortex are again made up of thin walled circular cells having lot of intercellular spaces, and they are having stored food in it, and the limiting layer of the cortex is the endodermis. Again, endodermis is having Casparian stripe, that is deposition of suberin and lignin, which make this layer impervious to water. And in monocot also, it prevents the backflow of water from the xylem to the cortical cell. So it is also a protective layer. And passage cell, that is thin walled cell without the Casparian stripe, is present opposite to all the protoxylem, because through passage cell water enters into the xylem through the cortex. So here you can see several arches of xylem, that's why it is called as polyarch condition, and the phloem patches, which is little green in color. So again, the number of phloem patches are equivalent to xylem arches, and the pith is very prominent here. Pith is well developed, and pith is made up of parenchymatous cell, and the cells which is present between xylem and phloem tissue, they are known as conjunctive tissue. And these conjunctive tissue in monocot, they are sclerenchymatous in nature. That means they are dead cells. Why they are sclerenchymatous? Because they are not going to make vascular cambium again. This is a monocot. It lacks secondary growth. No need of cambium is there. Same things can be explained by line diagram, which is much easier. The outermost layer is epiblema, having lot of root hair, then cortex, then endodermis, then pericycle, and yes, in monocot, the pericycle layer only give rise to lateral roots. There is no formation of vascular cambium or no formation of cork cambium. So here the pericycle gives only the lateral roots. And then polyarch condition of xylem, phloem present in patches, pith is very well developed, and conjunctive tissue are made up of sclerenchymatous cell. In dicot, conjunctive tissues were made from parenchymatous cells. Now this slide is showing origin of lateral roots in both monocot as well as dicot. These figures will show you that from where this lateral root is originating. Okay, so this is a monocot root showing a polyarch condition. You can see the bigger metaxylem, they are several in number, many in number, protoxylem towards the periphery and metaxylem towards the center. A very well developed pith is visible, and xylem phloem patches are also alternating with the xylem arc, and the conjunctive tissue are sclerenchymatous. They are deeply stained, they are taking more stain. And this is the endodermis, this darkly stained, and from the pericycle this lateral root is coming out. Even the vascular bundle of the lateral roots, they are connected to the vascular bundle of main root. So it is just to show that origin of the lateral roots are the pericycle. They become meristematic, like a small bulging, and then they comes out. This is a dicot root, and here also this is the epidermis or epiblema followed by cortex. This layer is endodermis, and this picture is not very clear, but you can understand that this lateral roots is again originating from the pericycle cell. Okay, so this is developing lateral root. This layer is pericycle, cortex, epidermis. Now a quick recap of anatomy of monocot root, and the model system for monocot root is the Zia maze. We are using it for practical purposes as well, and the model plant for dicot root is Cicer aratinum. Okay, so here again epiblema, they are having unicellular root hairs for absorption, and then cortex is again parenchymatous. The shape is round, having lot of intercellular spaces, and in later stages, when the root becomes little mature, the outer layer of the cortex, it becomes collenchymatous, and later something like suberin will deposit in that, and it will become exodermis. So in monocot, there is no secondary growth, so no cork cell will be formed. Fine, and with the age, the piliferous layer or epiblema, they started withering. So for the protection of cortical cell, this exodermis develops. Fine. And yes, when Casparian stripe and Petzer cell are present in the endodermis. Pericycle is again single layered and it gives rise only to the lateral roots because this is a monocot. Vascular cambium, they are polyarch in condition. Cambium is completely absent and the number of phloem is equal to the number of xylem. Fine. And then yes, conjunctive tissue are sclerenchymatous and pith is very well developed and without well developed. Okay. Now so this is a picture of a root apex. Okay, and I am showing you that the root hairs are only coming from the zone of maturation. This is a root tip which is growing inside the soil and it contains 4 different regions. The lowermost region is known as root cap. Root cap is made up of columnar cell. These cells are column-like, they are bigger and they contain lot of starch and they show gravitational stimuli. Fine. That can be easily seen because the starch grains are present in the lower side of the columnar cell. It is protective in nature and it protects the root apical meristem. And then this root apical meristem is bipolar in nature. It is giving rise to cells of root cap towards the lower side and the root proper towards the upper side. This particular zone is known as zone of cell division and here the cells are dividing in a very rapid phase because the main meristematic zone is present here. Then comes the zone of elongation. Here the cells are not differentiated yet. The smaller divided cells, they are elongating, they are taking their position and all different kind of cells which we have already studied few slides back, that is the epidermal cell, cortical cell, endodermis, pericycle, xylem, phloem, conjunctive tissue, pith, stele, everything is formed by this by this root apical meristem. Here the cells are elongating but they are not differentiated yet. As we move far towards this root apical meristem, then we may find differentiation of the cells. Then cell will become differentiated and performing their proper function. Fine. And then comes the zone of maturation. In this zone, root hairs are present. They started developing from the epidermal cell and even the lateral roots are formed only in the zone of maturation. And again from this diagram it is clearly visible that the lateral roots, they are originating from the pericycle. Fine. They are not superficial but the root hairs are superficial in origin. So this is a typical picture. Now a quick recap for the difference between a dicot root and monocot root. So as I told you earlier that from epidermis to endodermis they are same. They both look same but the stellar region is quite different. So pericycle in dicot, it gives rise to lateral roots, it gives rise to part of vascular cambium and it gives rise to phallogen, that is the cork cambium. They also originates from the pericycle. While in monocot there is no secondary growth, so no vascular cambium or cork cambium formation, they will only give rise to the lateral roots. Vascular tissue in dicots, they are diarch to tetrarch. Mostly they are tetrarch in nature but up to hexarch condition is seen. So xylem and phloems are limited in number, while in monocot the stele is showing polyarch condition, many arches of xylem. Shape of xylem vessel, that means when we are looking at the vessels in the transverse section or cross section, the xylem appears polygonal or angular in nature, but in monocot they appear circular. Here you can see these vessels are oval or circular in nature. Okay, so this is the major difference and this is same in stem as well. The xylem appears angular or polygonal in xylem stem as well in stem cells and In monocot, they appears oval shape. Okay. Pith is usually very small or underdeveloped. In dicot and in monocot, they are very large and well developed. Again, a difference in conjunctive tissue. In dicot, it is parenchymatous in nature. In monocot, it is sclerenchymatous in nature. That means deeply stained and dead cells. Secondary growth is present in dicot and absent in monocot. Then cortex are comparatively narrow in dicot roots and very wide in monocot root. And then finally the outer covering. The dicot shows secondary growth and then formation of cork cell, because this cork cambium is giving cork outside, so it is kind of protective tissue, while the monocot, they are only having exodermis. So thank you very much for your kind attention.